I found along the way, the most important thing that you can do is make the best use of the time that you have and not spend it on the little things that, don't contribute to the ultimate goal of your efficient practice.
Hello, everyone, and welcome back to Scaling Practice Management, where we help healthcare practices grow smarter, not harder. My name is Jakub Greitzer. I'm the head of marketing at Talkie AI. Everybody calls me Kuba. All my friends do, so you can call me Kuba too. And with me on the call today is Calvin Gooley, CEO at Cicada, a health tech marketing agency. Calvin, how are you doing today?
Kuba, I'm well. Thank you for having me.
Yeah, it's really awesome. How does it feel to be one of the very first guests on the show?
It's an absolute honor. I thank you.
Okay, awesome. That's great. So, Calvin, we are going to talk here a little bit about, marketing, which, for me, that's good. We're starting with something that, I'm kind of comfortable with because I'm getting immersed in the healthcare space still and learning a lot through it. This podcast is meant to be a vehicle for learning for myself and for the audience, right? So, I'm glad we're going to have a conversation about that. I hope that, the practice managers listening to this or people in healthcare in general listening to this are going to get some pointers about that. So we'll dig into that in a moment. You can talk a little bit about Cicada, of course, tell the listeners about that. But first, I got a little bit of an icebreaker question for you.
Okay.
I need to tweak this one because I usually ask it one way. I'm going to have to ask it a different way because we're recording this in February. So usually I would ask, Calvin, what is the most fun thing you've done this year thus far? But I guess, Calvin, what is the most fun thing you've done this year thus far or in 2024? You get a pass. You get 14 months to go through.
Okay, I have a winter answer and a summer answer then, Kuba. So my friends and I just this last week went to Utah for a bit of a ski trip. And we had a snafu at the car rental line. The van that we expected wasn't what we thought it would be. We ended up with something 5 times the size. So we ended up renting a 15-person van. It was great for bringing all of our friends to the mountain. Not what we wanted, but we made the most of it. And then the summer side of that is I got back from New Zealand the first month of January with my girlfriend, Eliza. So we had a great time over there. It was their summer. No need to change your question.
Okay, that's awesome. Wow. I have a friend that I used to work with, a past coworker. She just moved to New Zealand, so that's super interesting. Which also, by extension, increases my chances to land there one day. If I ever do, I'm gonna look at. Did you do any sightseeing of the places where they shot Lord of the Rings by any chance?
I did, and I'm embarrassed to say I've never watched The Lord of the Rings, but we made it to a couple different sites. It was beautiful, so green, so luscious. Lush was the word of the trick for sure. So
Okay. You've never watched Lord of the Rings. We'll edit that out to preserve your reputation.
please do. Thank you.
Okay, great. And then, so thank you for sharing that. And, that's just a way for the audience to get to know you a little bit better. And here's another thing, as I was thinking of, because this is one of the very first episodes of the podcast, right? As I was conceptualizing it, I was wondering what questions to ask at the beginning to kind of set the stage. This is a question I got as I was joining Talkie, because we're a health tech company, and I wanted to turn that question towards you as well. What made you ultimately, feel free to share any context that's relevant as well or background, what made you land in healthcare? Why are you in this industry?
Kuba, that's a good question. I assume that we both didn't plan to end in healthcare, and maybe you did, and maybe that's what led you to
No, not
Talkie
necessarily,
AI.
no.
So for me, it definitely wasn't planned. I was in an internship as a junior in college studying physics. And this internship was very technical focused, but I had the opportunity to work with a business development rep on acquiring new customers for their optics company that I was interning with. And at the end of that summer internship, I decided that I actually really liked the business development and marketing side of what I was doing a bit more than the more technical side, but I still had that technical knowledge to apply to what ultimately became Cicada, my company, our first client. So I added that first optics and peripherally medical client to our book of business. Then we were really lucky at Cicada, so we added an additional client for us that works in product development, specifically for medical devices. And they have been an excellent partner along the way, developing exciting new technologies and then looking to our team to help with the post-commercialization launch of those medical devices, reaching patients and providers. And that's really what we've built now 6 years of our work around. So to summarize that, had no intention of ending up in healthcare. I do have some family members in healthcare, but really glad that I did end up here, and it's a great community. So
Yeah, yeah. And I hope we can talk about that a little bit as part of this podcast as well. I mean, this is our way, my way, to actually get closer to the community, right? Through interviews like this. And thanks again, by the way, for agreeing to join the show. All right. So with that out of the way, I wanted to ask you, like, let's call it the key question of the show. Every guest is going to get this one. You're one of the very first people to hear it. And it's about your number one tip. So let me phrase it properly, Calvin. What is your number one tip for successfully growing your business in the healthcare industry?
okay, I'm sure that there are a lot of different ways to grow your business, particularly if you're thinking about your private practice and you've made the jump to start your own business for the first time, which is really exciting. It's something that I greatly enjoy as a founder myself, and working with so many different founders. I found along the way the most important thing that you can do is make the best use of the time that you have and not spend it on the little things that don't contribute to the ultimate goal of your efficient practice. So, for example, we help very early stage clients who might think that they're too early for something like a customer relationship management technology, just start to track their email. It's something they can do to add operational efficiency right away without adding that burden I was talking about avoiding before. So for them and for their eventual marketing team, whether it's Cicada or an in-house team that they hire, they're able to begin to build that database of contacts that are relevant to either their care practice, or maybe they have a device of some kind, or, we work even with some virtual practices that start to build their database of constituents, even if they're fundraising, right? And I know that's not necessarily relevant to your audience, but it's important to keep track of in a way that doesn't require you to maintain a spreadsheet or maintain a big, slide deck of all the things that you're doing. Just in the background, how can you build value without impacting your own work? So if I had to say that a bit more succinctly, the number one tip I feel like we could talk about a bit more today, given my background in marketing, is ways to optimize sort of your patient acquisition journey. Think about how, some outsourced digital marketing could possibly support retention, help build your profile as a clinician if you have your own practice and you're starting for the first time. And then also think about ways to make it easier for folks to engage with your business. And really that is, something that I've been working on at Cicada. How do we work with our partners better to ensure that we're supporting across our clients and across our early stage founders who have really exciting businesses to bring to the market?
I like that. I like that quite a lot. And I think in terms of the patient acquisition journey, I'm going to latch on to that for a bit for this episode. We're going to get to that in just a second. But first, so you're already mentioning, some of your clients and quite a bit about Cicada. So let's get that piece in so that people know who they're listening to actually, right?
Sure.
That's the number one tip. I like it. And we'll dig into that in just a second. But tell us more about Cicada in the meantime.
Sure. Cicada is a medical device and consumer health marketing agency. We started 5 years ago. We're now a team of 10 based in Boston, but we deliver our work remotely for clients that are commercial launch stage. So I think that covers it.
Okay. What's your favorite thing about running Cicada?
Ooh, it's all the different clients that we get to work with. And you asked me how I got into healthcare in the first place. I also wasn't sure or couldn't commit to just one client, right? Leaving university, thinking about where I wanted to end up next. I really enjoyed the different clients I was already working with in my own very, very small at the time business practice, and I just couldn't give that up. So even today, I still get to work with different exciting dynamic businesses, and often teams that have very advanced degrees and CTOs that are working on exciting algorithms and all sorts of things that I wouldn't have exposure to otherwise. So
That's great. That variety, I can definitely feel that. Okay.
yeah.
So let's talk about the patient acquisition journey for a moment. I imagine, some practice managers listening to this, they're facing certain problems with this journey. I wanted to ask you, from your experience, what are some typical challenges there? Where might they be seeing blockers? Who might be listening with what kind of challenge that we could help today through this conversation?
Couple ideas, Kuba. So we recently put together a Series B slide deck for one of our clients, and they're solving the problem of incredibly long wait times in the PET, so positron emission topography scanning space. And for them, they've identified and the practices that they work with have a challenge around patient satisfaction for folks who can't book a time to receive one of these PET scans uh, at all. Like it's a 2-month wait time at best in certain cases. In some cases, it's a 2-year wait time. So our perspective around this, and my experience in working with this, is often what technologies are solving those sorts of issues, right? Where can we increase the scan volume that's available to a specific clinic that's assisting with the dementia screenings that this software enables? So for us, we like to think about documenting that value very well for our clients who are on the device side, who are working with these clinics, trying to achieve investment milestones so that they can get to that next important stage for their innovation and continue to commercialize and offer these exciting new opportunities that ideally make it easier for patients to engage and find times with the practices that they need. So that's along the sort of very early patient experience side of things. And also just, in general, it's very important to have early detection in Alzheimer's and dementia, speaking about this patient specifically. And so across all care areas, something that we are often documenting is how do we reduce the amount of time that it takes for someone to engage with. Often it's the customer of our clients, a private practice, a specialty clinic, and how do we improve that relationship in a way that benefits both that practice and our client.
Okay. Lots to dig into from what you mentioned here. What stuck with me was when you mentioned the wait time for PET scans and the lack of bandwidth on the practices side. I feel like, for intuitively and from experience, I feel like a lot of practices are gonna sympathize with that and they would like to find some sort of solution for that. Do you have any advice to share on, because obviously this affects people's, health outcomes, right? So is there anything that can be done here to try and improve that?
Kuba, say a bit more too, because there's probably so many parts of that very complicated problem. Like staffing is a major issue. How do you think about it? How can I talk to this a bit more?
I'm honestly asking from a position of I want to see the whole picture of the problem. So, for example, staffing might be one part of the problem. What are some of the other parts there? Because ultimately, you can break it down into like a whole process, right? There's steps in this process, and which of the steps could be addressed to try and make it easier to get one of these scans or to make it, well, to reduce these wait times, right? Let's talk about
Mhm.
that.
So for our client here, it's all about increasing the scan volume, reducing the amount of space that the technology itself takes up within the clinic was a very important part of their innovation. So the way that the form factor of the scanner itself is designed allows for not a traditional bed MRI size scanner. Like you can imagine the size of the real estate and the square footage that you need to support that. If we can increase the scan volume and scanning capability of a specific practice, that already should reduce those wait times, add to their capacity. And I think that's something that you'd see really, and you mentioned intuitively, probably happens across all practices. I know that's very specific to this one case. Another area that I'd say oftentimes, and this is more at the, say, mid-size practice level, we see partnership and outsourcing to, say, outsource billing companies. And so we have a few different partners in that space that help just with all of that manual paperwork. And back to what we were talking about before, in increasing efficiency on the office side, increasing even the revenue cycle is very important. And I know it's something that I think about with our own business, and our clients think about: how do we increase the velocity of making sure that we are able to serve our patients more quickly, get them the care that they need. And so we've worked with some great partners on the back end who have facilitated better billing practices, automated that in some ways. And we've even partnered in some cases to make that experience part of the product. Again, my perspective at Cicada, working to market medical device and healthcare technologies, we also sometimes consider the patient experience, because those are our ultimate promoters, the folks who share the reviews and either tie it to the practice that's offering that, or our clients, the developers of those devices and products.
Okay. So what I'm hearing is, and that definitely tracks, I can say, from a marketing perspective, part of the patient acquisition challenge is definitely the patient experience. A happy patient will recommend you, which increases your pipeline, so to speak, of future patients, right? So let's stop there for a second. What have you seen? What are some of the recent trends there for improving patient experience? I'm sure there's a ton of different areas to look at. Just something that you've recently seen comes to your mind, maybe that it's not popular at practices yet. That would be interesting for me to hear about. And for the audience. For the audience as well.
Yeah. I hear a lot of complaints about wait times. I'm not quite sure what to do about that necessarily, other than some of the things that we've talked about already. But I can share one example of a client of ours who really helped their patients see progress in a visual way. And this gets back to what I was talking about before in making, and I'll tie in a little bit of marketing too, but what I was attempting to share before is that we have some clients who might use a video testimonial as part of their marketing process. So you had mentioned, hey, what's our number one tip, and how do we make sure that our our practices are bringing in clients effectively and patients effectively. And reviews have always been very important on the local SEO side. And where I think, back to our patients here, this should all come together, is for these patients who hadn't really visualized how the therapy, in this case, was helping them. We had helped the in-house team at the clinic develop a testimonial generation system. So essentially just a baseline video recorded at first, and then a 30-day video recorded as a follow-up for someone who has difficulty with movement to review and see their own progress. That actually became part of the product, the therapy product that's being delivered to that patient. And when they complete their first therapy session with the product, that testimonial is recorded. And then for our marketing team, that's something that we can definitely leverage across referral networks, building the brand value. And for some of our private practices that have access to this device, it's quickly shared in the care advocacy communities. So think, and the example I'm thinking of here, we have a client in the epilepsy space who supports many different epilepsy groups, and those have strong referral networks within them, particularly locally. So if someone knows about a new innovation at a new clinic, it pulls folks in, and that really does increase the patient experience when someone can see progress.
That's very interesting, because I'm thinking about these videos that you mentioned, right? That really serves like a twofold purpose. On the one hand, it helps the patient realize their own progress. On the other, for the clinic, for the practice, it's great social proof that they can then use outside to try and help more people and get more patients. I want to hear more about that. Somebody listening to this might be thinking, hey, that's a great idea. I would love to implement something like that. Can you talk a little bit about like getting into the nitty-gritty, how did you operationalize it? Is there a waiver that the patient signs? Is this
Mhm.
done just as part of one of the sessions? If you can give more detail on that, that would be fascinating.
So it depends on who we're talking about here. So let's use the example of a private practice, and let's pretend we're that private practice. So I've seen examples of newsletters sharing patient progress and social media posts, and oftentimes uh, the post itself is initially de-identified, right? The person's face isn't in the video to start with. It's a very hyper-focused to the care area uh, video of their progress. And that is probably the first step that I would consider. We don't want to be revealing someone's identity or exposing ourselves if we don't need to. Obviously, there are always concerns around patient privacy, and each of in the cases that I've seen this where practices are implementing it themselves, they don't have a regulatory person in house like our clients on the device side do. They are certainly just using DocuSign operationally to work with their patients on, a media release waiver or something like that. And they've operationalized it a little bit, but it's being shared in newsletters and social media and their releases, probably compared to say a media release that we work on at Cicada, a little bit more benign. I don't think it's often being used for advertising or anything like that. So, and I should clarify, I don't have a legal background, so I'm sure that there's definitely things that practices have to look at that our device clients, when they're soliciting testimonials, don't necessarily, we don't have to worry about because their in-house regulatory team handles that.
Okay. So that's already a very interesting takeaway for me from this conversation. This idea of videos. So we might get back into that in just a moment here. You mentioned something else in passing that I think is on a lot of practice managers' minds that I wanted to fill in. So you mentioned local SEO, right?
Hmm.
I don't have a lot of experience myself, even as a marketer, with local SEO. And certainly
Okay.
for a practice, I imagine there's specific nuances here that I might looking at. So could you give like a rundown of like what are some of how to phrase it? Maybe some of the most common mistakes, other than not doing it in the first place. Uh,
Uh,
your best advice on how to improve local SEO, given that I imagine it's not at the top of the list in terms of time investment for practice
mhm.
managers, but they still want to do it, right? So what's the way?
And back to what we were talking about before with maximizing time investment, there's a few key things that you can do that should not take too much of your time. So, uh, mistakes that I've seen, sometimes there's multiple locations for a practice under the same, it's called a Google My Business Manager. And the multiple locations definitely need their own Google My Business Manager, their own location set up to maximize visibility. So if someone's searching for, say, like an orthopedic surgeon near me, you want the closest location of yours to show up. And I know this is for a larger practice, and but that is something that we're seeing with larger practices that have a diverse local population and different locations. Certainly don't have that under just one location online. Uh, the other thing, and back to testimonials, that's really a low lift but high impact, is making sure that you have reviews on each of those Google My Business Managers. So uh, reviews, they're a little bit less important than they used to be, but that social proof is crucial. And having those great reviews on your Google My Business certainly help increase your visibility in the local SEO market, particularly if it's competitive. Uh, you know, Even very large hospitals do compete for local patient volume, and those reviews help with what shows up first.
Okay, I hear that. And do you have any advice specifically, for a practice that might be struggling to get these reviews? Like they know they have happy patients, but they just don't find the time to leave those reviews. Usually, sometimes there's some sort of incentives. I wonder if you have any tips for that.
I've seen some outsourcing cases where there's firms focused on review generation. There's entire companies that do this, where not only do they help solicit the review, but then they also respond to the review to double the engagement on each review.
Hmm.
But if you're just running a smaller practice and you're not ready for something like that, or that's not a major part of your approach, something you could do is just add that review link to, some of your top patients' surveys. So if you're surveying your patients in any way, asking them about their experience at the end of that experience survey for your top promoters, it's always great to serve that review link and let them know, hey, we greatly appreciate working with you. It would mean a lot to us if you could leave this review. And that's one way that you can make sure the folks that really care about the work that you're doing are the ones that are leaving great reviews for you. And really, it comes down to just asking people to do that. Not a lot of people, at least I know that I don't, think to review the different businesses they interact with on a day-to-day basis, particularly for, the majority of the population that is attending a lot of the clinics that we work with.
Yeah, exactly. It's hardly on top of people's minds to leave these reviews, right? So a little bit of a nudge, some reminder, or a clever way to make it just like a natural part of some other process, like a survey, that can really help. So here's what's in my mind. You mentioned, because I'm still on the subject of, I told you I'm going to latch onto it, the patient acquisition journey, or patient acquisition in general, right? So we're looking at certain ways to improve that. We talked about improving the patient experience helps retention, helps referrals. We got that. We talked a little bit about social proof and video. We got that. And then local SEO. So we've got at least 3 different ways to improve it. But I wonder, somebody listening to this might be saying, okay, so I've got these 3 ideas. How do I even prioritize them? Are these the best ideas to improve patient acquisition? Is there something else that should be number 1 on the list or number 2 on the list? What would your list look like?
I don't think it would look too different from really how we've been talking about it, but I know that truly a lot of the models, let's maybe talk a bit about why someone wouldn't prioritize that local SEO or that review strategy. And in those cases, at the top of the list, you might see a referral-based model. So if you're relying more on physician referrals, or if you have very strong health system connections, you would certainly deprioritize local SEO and that review generation. If you're a larger, really well-known practice, you would definitely be relying more on your brand reputation. You wouldn't need to focus as much on that organic search need that we were talking about before. And maybe you have a marketing team that's thinking about your paid search strategy, even in that case, where you've got great coverage for all of those things that we were just talking about already, where the lift to create some reviews isn't as impactful for you. And maybe you even have some content marketing, right? Or a podcast of your own. So partnerships beyond the local SEO that we were talking about there. It's, I guess bottom line, it's definitely important for, private practices, those looking to drive direct patient traffic, ranking well and bringing sort of my SEO experience for our clients always plays a role in strengthening your flow of whether it's patients or potential partners to work with. I would say that there's definitely always opportunity to be had there, but it definitely might not be the first thing. And I'm actually sure it's not the first thing on most folks' mind when they're starting up their private practice.
Yeah. And what I'm trying to get at here is, what kind of list should they go through, down this list of, okay, if I've got, let's say, if I'm getting reviews and referrals, which I suppose would be number 1,
Hmm.
probably regardless of the size of the practice. Would you agree with that?
Mhm.
So if I'm getting referrals and reviews, like what's next to improve patient acquisition? The next thing to invest in, and I don't imagine that would be content marketing necessarily, because that's like a long-term play. It's a slow burn. It can definitely help a lot, right? But I don't think, let's start a blog for our practice is the first thing. Rather, maybe the local SEO bit. I'm just trying to arrive at this, at the prioritization of it, really.
Okay. I hear you, Kuba. So if we have the list, and I'm going to take a guess at it because the practice side isn't really my area of expertise. I work with the devices that are then sold into these practices, but I'll share how I would think about it. And if we've got that base level of online visibility, whether it's a way for patients to book with us, or, we've optimized that Google My Business profile as number one. And I'll even fold in, we've already got our referral network set up completely. Number two, I would say, is make sure that we have a strong patient experience. So the equivalent in my world is make sure that we have a great product. That makes it easy for us to get those referrals and those reviews in the long term, like we were talking about before. So one, making sure we have that visibility or referral. Two, making sure that it is very easy for patients to engage, that we aren't getting disgruntled reviews, and that, maybe there's some communication strategies around email or text that help streamline that patient experience. Even the implementation of some patient portals, we've seen improve that on the private practice side, certainly. And then, maybe there is some way to, as a point three there, and just wearing my marketing hat, think about how to diversify your marketing channels a little bit. So, and we mentioned paid search. I know that there's some folks on the social media space that are doing some great social media video, like we mentioned, but also tying in some email nurture campaigns, and then thinking really about retaining patients. How do we continue to bring them back?
Yeah. Can we talk about social media for a bit? So I'm thinking, okay, this is going to be an example that's adjacent to the space, but not necessarily. Just a few days ago, I arrived at a tattoo artist for my next tattoo, right? And the way they acquired me, so to speak, was organic and paid Instagram, right? I saw their work, I could see it with my own eyes, and I'm looking for a colorful tattoo, and the artist, she did really great colors, right? So would you say, I guess this is a leading question, right? But maybe there's nuance here that I'm not seeing. Would you say, for a practice that's like in the beauty space, for example, right? Or aesthetics. Am I saying that right? Aesthetics? Yeah. So would you say that organic social media might be part of the strategy? Have you seen that done? Any tips on that?
I have seen that done. My tip for that is, and sorry to go back to this, but really video is crucial. And I know with a tattoo, that's something that is, maybe not as conveyed as easily through video, but there's certainly
Oh, you'd be
reels.
surprised, actually.
Oh,
They
really?
do show, like, the moment they wipe off, there's this kind of foam that,
Sure, the
right?
reveal.
And that reveals the tattoo. Yeah, it's really great. My feed
Yeah.
is full of that right now, and I love it.
So showing the outcome where we can is definitely something that people really, I think, resonate with and engage strongly with. So I would certainly recommend social media, continue to do so. It's much more challenging, I think, than it was a few years ago. We talk a lot about stopping the scroll and just the sheer amount of volume that our audiences see on a day-to-day basis in that content. So the content has become quicker. It's become, much less, I'll say, in depth. So very surface level. How can we get someone to achieve that one moment of awareness, even if it's, under a second of their time?
Yeah, yeah, that's really sinking in right now from this whole conversation, almost the whole conversation. Find a way to show it. And from what you're saying, find a way to show it on video, like the before and after of therapy, before and after of surgery,
Your
before
tattoo.
and after of getting a tattoo, right? Again, adjacent to the space, but just, I was looking for like a relevant example. That's cool. Okay, so I wanted to switch gears here for a second and talk a little bit about technology. So what I'm curious about is, let's talk about healthcare in general, and let's make this more of a broad question. But I'm wondering about, because right now it seems like the pace is really, really fast of innovation, right? There's new AI tools launching every day. Not everybody's aware of tools like Talkie, for example. We pick up the phone, our AI picks up the phone, so your medical front desk doesn't have to. Talkie.ai, go check it out. Anyway, back to the question. What are some of the trends, innovations, new technologies that you're seeing that are, cutting edge, fresh out of the oven, something that practices or just the space in general should be more aware of? Can be AI related, doesn't have to be, but anything that you've seen that you would like to spread the word about?
I'm very predisposed to any sort of wearable device. I love sort of the next generation of, maybe it's a continuous glucose monitor or something that allows the person to have some visibility into their own health data, right? So I've tried Whoop, I've tried the Aura Ring. I had a great experience with both of those. I don't have a wearable that I'm using right now, but for us and for a lot of our clients, I think it is really beneficial to see and track progress where you can. And you mentioned that's a theme of this conversation. So we're seeing wearables and wearable sensors that even just help someone, uh, you know, track their gait and how that's changed over time as it relates to a therapy, or maybe they have a goal of becoming, a bit more fit and moving a bit more. And so that sort of thing that allows you to both be accountable to yourself, in some cases accountable to your provider, if they have access on the back end to a platform that you collaborate on. That's something that's very helpful in certain cases. An example I'll share with you is we worked with a client who developed a sensor for a prosthetic device. And the founder had a glucose monitor, and monitoring his glucose levels he found to be very inspiring, to eat healthy and to have great practices just in his own exercise. And he applied that to his 25-year career in the prosthetic space and developed a sensor that both tracks someone's daily movement, gives uh, the folks on the clinical side an idea of actual utilization of the prosthetic, which before there really wasn't any insight into. And so for someone who is, maybe a bit less mobile than they'd like to be, it's a great way to track your progress and see growth. And for the client, or for the clinical side of things, it's a great way to truly understand and have that objective measure of, hey, our prosthetic is comfortable and our patient is wearing it.
Okay, so the kind of data it collects, I'm curious about this. So it collects like how much the prosthetic is used. What other data is in there?
So, as just speaking generally, I think what's exciting is things like wear time and total mobility measured in things like steps. But you can also measure things like variable cadence, where you're thinking about, hey, is this step in this locomotion something that we would expect? And is the prosthetic working correctly? And you can start to really dive into, okay, maybe something changed and something broke here because we have a massive change in the variable cadence week over week or something like that. Other things that you can measure, outside of that specific example. We worked with a client who did some fall detection, right? And I think that's recently been added to the latest generation of Apple Watch. So it's exciting
I
to
heard about that.
see, you know, new fall detection technologies on the marketplace in a system that everyone's familiar with.
Okay, that's really fascinating. I mean, I've got experience, direct experience. I've got one of these wearable devices
Oh,
myself.
nice.
um, with tracking my data for my own purposes, for me tracking my own health, etc. But what you're making me aware of, and maybe some of the listeners too, is that this data can be also used by your provider, by a practice you're attending, and that's so much more useful. At least the way I'm understanding it. That's so much more useful compared to you just coming in one day, checking in with your doctor, and them asking like, so how's it been? And it's all really anecdotal. It's really
It's
it's
not
based on your
objective.
own. Yeah, exactly. It's subjective based on recollection. It can be even influenced by your mood on a certain day, right? The way you talk to your doctor, and that's all they have to go. That's all they've got to inform, their next recommendations. If they've got some hard data, I believe that can improve outcomes.
Absolutely.
Okay, I love that. I love that. Okay, so I have got one last question for you because we're slowly running out of time for this particular episode. It's been a really fun conversation thus far. So, and this one again is a bit of a change in the subject matter. So, this is a podcast for practice managers, but these practice managers often are also just straight up business owners. You're a business
Hmm.
owner yourself. So I wanted to ask about the most important tools and resources that you use in your daily work This can be tools as in apps. It can be some sort of framework that you're using, something that you just can't live without, something that's very helpful for you so that others can get some inspiration from that.
We're a Google organization, and I really do like the G Suite setup, but I will admit that, Google Meet has some shortfalls, right? So I think that, making sure that whatever it is that you're using actually meets your needs, it isn't over-engineered, and it doesn't take extra time for you to log in or let a visitor into the meeting. At least for us, those are the little things that make it, and for our clients, reducing that friction where we can. That's what makes it a bit easier. And I mentioned this before, but the CRM I had in mind when I was talking about how can you start to collect your outbound emails to build that list of your constituents. We're both a HubSpot and Salesforce partner, but I, as a marketer, have a strong preference for HubSpot. And just thinking about their account-based marketing tools is something that I really enjoy working with our clients who are on HubSpot and building out exciting new automations that maybe reach out to someone at the opportune time for a testimonial or something like that and allow us to do that really intelligent marketing communication that drives, again, outcomes for our patients.
Okay, that's
Do you have
cool.
can I ask, do you have a favorite tool, Kuba?
I was just about to add in one of my own. Okay,
All
so
right.
they're going to launch on Windows as well, but I imagine if you're a business owner, some of you might be using MacBooks, right? So if you're on Mac, right, in general, I really, really, really recommend Raycast. I can't live without Raycast, and it's the first thing I install on any Mac that I use. So it's like a Swiss Army knife in terms of what it can do. You can use it to launch apps. You can use it to navigate. Like if you install a Slack integration, you can use the shortcut, sorry, to bring it up. On my keyboard, it's Option Spacebar, right? And then you can just type in somebody's name and you go straight into Slack, straight into that window. But the way I use it primarily is for notes, for example. There's a feature there where you can have like a floating window with your notes, and it's always on top, and that's super crucial. As I'm recording this with you, Calvin, I've got my window here on my screen, always on top. That's where the questions are. That's where the notes are. I don't have to switch into other like desktops. I don't have to look anywhere else. It's right on top, right? So it's super, super useful. It's got like snippets of text that you can use, kind of like text expander, but it's built in, and a lot of other integrations. I bet I'm not even using like 15% of what it can do, not even 20% of what it can do, right? So, sorry, I'm really excited about that one in particular because it's just such a useful. I like the tools that improve your moment-to-moment user experience just with your computer,
Yes.
and Raycast is that. So, here's a tip from the host,
Well, I've
everybody.
got another Mac one if you're interested, and this is one that maybe the audience and healthcare providers are super familiar with and have been doing much longer than I have, but just the dictation feature on the MacBook, make sure to set a hotkey for that. So I just double tap my control key, and then I'm easily able to dictate right into whatever program I'm using at the time. And it just makes it much easier than starting the dictation in any other way. It's become part of my workflow, double tap control, and I'm off to the races. So I think that really helps increase even quick messages, through Slack or anything like that, are sometimes dictated for me. So if you see any typos, that might be why.
I like that. I'm gonna try that. I don't know if anybody noticed, but I'm a talker, a writer too, but a talker definitely. So if I can talk to my computer and have that dictated, you never even know what's gonna be useful. All right, I love that, and I hope that's gonna be useful for the audience. I should get some feedback on this segment, see if that's useful. So hey, if anybody here is listening to Scaling Practice Management and want to share their thoughts on this segment, find me on LinkedIn, Jakub Greizar, and leave me a message, and we can talk definitely. All right, speaking of finding people on LinkedIn, we're going to be winding down here slowly, Calvin. So I wanted to ask you, where can people find you? Where can people follow you? Is there anything that you want to direct them to? Where should they click? Where should they go?
Well, Kuba, thank you so much for having me and organizing this. And I'm just Calvin Gooley on LinkedIn. Cicada is cicada.co, and we're on LinkedIn as Cicada. So you can find us there, and always happy to chat.
Out of my own curiosity, how did the name come to be Cicada? Why that?
So my dad and I were on a hike, and we were bouncing business ideas and names off of each other, and that was one that stuck. There's really no true marketing meaning behind it or anything Kuba, but I have heard over the years some different maybe things that I should have thought of. So one is cicadas are very loud. They definitely make their presence known when you're around them. The other one that I've heard is you see a milestone every 17 years with cicadas where there's a very large release of cicadas into the environment. They come out of their hibernation. There's different broods for cicadas, and for our clients, oftentimes they're trying to get to the next milestone. So maybe that one's a stretch, but that's the other analogy I've heard, that we help them get to that next inflection point or milestone where they're really able to take it to the next level. None of those were thought of in advance, and I don't think they really apply now.
Yeah, no, I love that. I love that. It's kind of like with tattoos, Like, so I got this tattoo. I'm showing it for the viewers, not so much the listeners here. So when I was thinking, we talked. Let's bring it full circle. We talked about getting into healthcare in the first place, right? When I was considering whether I should join Talkie, because I did a little bit of soul searching around that, it was the evening. I was trying to make my decision, and I looked at my wrist. It looks a little bit like like the healthcare cross kind of thing, right? And then, I'm not saying this is 100% what influenced my decision, but I thought, hey, that's one way to interpret it. And I've heard so many other interpretations. So tattoos, brands are like that, and names are like that. So that's one last piece that's a little bit out there for this conversation. And that is it for today's episode of Scaling Practice Management. Calvin, thank you so much for coming on the show. It was a really interesting conversation that took us places, definitely, and I hope it's going to be useful for you watchers and listeners. Definitely go follow Calvin on LinkedIn, go follow Cicada, and if you have needs that Cicada might serve, then you should talk with them. And in terms of who brought you this episode and this show, hi, we're Talkie AI, and we're an AI voice agent for your medical front desk team. And you can go to talkie.ai to find out what Talkie can do. It can pick up your phones. It can make phones to patients. It can help you with scheduling. It can help you with prescription refills. And by you, I mean it can help your patients and take some of the burden off of your medical front desk team. Talkie.ai. Go check that out. And you can follow us on LinkedIn as well. We're Talkie.ai there as well. And you can follow me, Jakub Kreitzar, on LinkedIn. That's where you can get info about new episodes of Scaling Practice Management. There's more coming down the pipeline, so stay tuned. That's it for today. Thank you everyone so much for watching and listening. Kevin, any last thoughts to share before I hit the stop button on the recording?
No, Kuba, thank you for setting this up. It's a very important topic that you're covering, and great work with Talkie AI. So looking forward to seeing what you guys do.
Thank you, Kevin. All right. Thanks, everyone. And we'll see you I always make the same mistake. I'll see you, watchers and listeners, in the next one. Bye-bye.